Good morning to all of you who make this broadcast possible, and to all of those who follow us daily. Today, 246 people are hospitalized in Cuba. 5 are under observation. There are 189 suspected cases and 52 confirmed active cases, a lower figure than we've seen over recent days. In our primary healthcare system, 155 people continue to be monitored by our professionals and specialists. Yesterday, our various molecular biology laboratories processed 2,959 samples. 1,053 were processed at the Pedro Curi Tropical Medicine Institute, 562 in Havana's Hygiene, Epidemiology and Microbiology Center, 346 in Villa Claras, 283 in Santiago de Cubas, 387 in the Hermanos and Majeres Hospital Laboratory, 282 in the Genetic Engineering and Biotechnology Center Lab, and 46 in the Civil Defense Laboratories. Of the 2,959 samples processed, 1 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country to 223,698, of which 2,445 have tested positive for the virus. Like I always mention, samples were taken in all of the country's provinces, not just Havana. For example, yesterday, 175 samples were processed in Matanzas, 73 from Ciego de Ávila, 67 from Camagüey, 64 from Las Tunas, and 91 from Santiago de Cuba. Samples were also processed in the country's remaining provinces. The one positive case diagnosed yesterday is a Cuban. The source of infection is yet to be determined, bringing the total number of cases where it has not been possible to determine the source of infection to 112. 2,123 cases diagnosed in Cuba have been confirmed case contacts, or 88.3% of all cases. That's why it's so important to test people belonging to high-risk groups. 186 people contracted the virus abroad. The case diagnosed yesterday is male, representing 50.4% of all cases, while females account for 49.5%. Yesterday's case was asymptomatic. It's important to note that most people diagnosed with COVID-19 have been asymptomatic at the time of testing. That is 54.7% of all confirmed cases. And over the last 15 days, the percentage of confirmed cases where the person has been asymptomatic at the time of testing has risen to 83.5%. The patient diagnosed yesterday is 21 years of age and from the province of Havana, the municipality of Regla. No children tested positive for COVID-19 yesterday, for a continued total of 277 that have been diagnosed with the virus to date in Cuba. Meanwhile, 269 individuals under the age of 20 have recovered without complications and been discharged from hospital, representing 97.1% of all cases in this age group. Yesterday's result means that Havana continues to be the province with the highest number of COVID-19 cases per 100,000 inhabitants in the last 15 days, with a rate of 3.65, lower than yesterday's. Next is Mayabeque with a rate of 0.26, also lower than yesterday's. Cuba, with a rate of 0.71 confirmed cases per 100,000 inhabitants over the last 15 days, is also lower than yesterday's. In Cuba, of the 2,445 patients diagnosed with COVID-19, as I previously mentioned, 52 are active hospitalized cases, representing 2.1% of the total, and all of which are clinically stable. Today, we have no serious cases to report. For the last 21 days to date, we haven't had any critical cases. This is the result of measures taken to detect, hospitalize and treat patients, as well as administer preventative treatments to at-risk groups. As such, today, 100% of all active cases are clinically stable. There have been no deaths to report for the last 7 days in our country. Since the pandemic began, Cuba has registered 87 deaths, for a mortality rate of 3.56%, which, compared with the regional rate of 4.12%, places Cuba 21st in the Americas. When we look at the mortality rate globally, Cuba places 118th, moving down from 107th position yesterday. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Another positive indicator is that 4 people were discharged from hospital while only 1 new case was reported yesterday. This means that to date, 2,304 people have recovered from the virus in Cuba, representing 90.3% of the total. Now we're going to turn our attention to the world for a few minutes. The global situation is out of control, according to international organizations like the World and Pan American Health Organizations. As of yesterday, COVID-19 continues to be present in the same 185 countries. With 257,672 new cases reported yesterday, the total number of COVID-19 cases worldwide rises to 13,788,300. Yesterday, 5,796 people died of the virus, for a total of 589,688 COVID-19 fatalities, and a mortality rate of 4.27%. With 160,084 cases reported yesterday, this brings the total number of COVID-19 cases in the Americas to 7,325,723, or 53.12% of all cases worldwide. 3,731 people died of the virus yesterday, bringing the regional total to 301,997, and a mortality rate of 4.12%, as previously mentioned. I also want to talk a little bit about treatments. The issue of treatment is interesting given the current global situation. We've been hearing a lot about remdesivir, a medication used to treat COVID-19. A recent article reported the controversial purchase by the United States of almost all supplies of the medicine in existence, a medicine which, according to all studies and tests conducted thus far, is considered promising. However, we've got to bear in mind the cost of producing remdesivir, according to an official source cited in the article, is about $10, while treatment with the drug costs about $3,000 per patient, which shows how treatment is being handled from an economic point of view. This also shows how the pandemic is not being approached from a humanist position, quite the contrary, but how the issue of treatment is affecting people around the globe right now. This is the information that we have on the behavior of the pandemic in Cuba and across the world.